My name is Rohan Kulkarni, and I lead the healthcare and life sciences practice at HFS Research. HFS Research and NTT Data are collaborating to understand the impact of interoperability and digital transformation on the key metrics of health plans, particularly in the context of the triple aim of care. We are seeking to understand how changes to financial metrics like revenues, cost of care, and operations, as well as margins, member health outcomes such as reduced obesity, improved chronic care management, as well as experience, member experience, employee experience, and provider experience can be attributed to digital transformation and the implementation of interoperability. To help me make digital transformation and interoperability real, I am joined today by Hans Hage, who is the Chief Product Officer for Consumer Operations at UnitedHealthcare. He has a history of driving digital transformation and developing products and services across digital channels with a focus on clinicians and administrators. Welcome, Hans.
Thank you for having me.
Absolutely, our pleasure. Let me dive right in there. Healthcare in general has been accelerating the adoption of emerging technologies while hardening its legacy investments. Technology has been applied to streamlining processes between health plans, providers, members, and other stakeholders in the healthcare ecosystem to improve clinical care management and enhance member management, amongst other benefits. Many of these digital transformation efforts have impacted interoperability. So let me ask you, where do you see the industry with interoperability, and where do you see health plans prioritizing it overall?
Perfect. It's a great question. I would say, just to start, health plans see, and they have seen, the benefits of interoperability for years. Oftentimes we'll get the question, why is healthcare so expensive? And a big part of that is because of the technologies and the systems that are necessary to administer care are both disconnected and in some cases archaic. Which leads us as health plans to have to hire people to manually key information in or transfer between systems. And that creates explicit cost tied to human beings doing something that should just work and technology should be able to handle for us. It also increases the number of errors associated with data being entered in out of sync or being keyed in incorrectly, which then has a pretty big consumer impact. What's particularly interesting about the challenges associated with interoperability is that it's not just about how a plan communicates with the provider and how they both communicate with a member. It's oftentimes you'll see that within the four walls of a health system or a payer where the biggest gains from, for instance, FHIR-based APIs can be realized. So with all of that being said, I would say interoperability is a major priority for health plans. From the sense that we know that true interoperability is going to reduce the cost to administer plans, as well as improve patient outcomes if it can be achieved. Where it gets really interesting, I would say, is if we zoom out and we look at the larger environment. We're at a crossroads right now because we've got three major converging factors coming together. One of those, and we've seen this trend for a number of years, is health system consolidation in the United States. Bigger hospitals and health systems are buying up smaller hospital and health systems and so forth. The second factor is that many of these systems have very large technology debt. They have competing EMRs, they have different practice management systems, and oftentimes those systems within their same organization have embedded care management and unique patient intellectual property that are all tied to the way that these systems are supporting their patients. And there's a lot of times really great reasons for that, but it's a headwind to interoperability as a whole. So I would say that that's a third factor or second factor. The third factor would be that the margins of a lot of the hospitals and health systems that we work with are incredibly thin, very small. There's not a whole lot of money available for new investment to tackle some of the tech debt and some of the challenges that exists with the factors that I mentioned in the front coming into play. And so I bring this all up because the payers can embrace interoperability to their heart's content, but we really have to partner closely with the providers and ensure that the things that we're trying to get them to do or we're trying to embrace from that perspective are actually aligned with their overarching strategy of reducing cost and decreasing some of that tech debt. I would say, not speaking for any one payer in particular, but we have to lean into multi-payer strategies. If you look at the average hospital or health system, they're working with between 17 and 23 different health plans. And so the convergence at the EMR is something that's really important, or we won't see the traction that we want to see. All of that being said, I think the outlook's really bright. It's a long journey, and it's the journey, not the destination. And the destination is going to require patience and time, and just a really strong, consistent partnership with the hospitals, with the health systems, and the health plans in order for that true vision to be realized.
Fascinating. Thanks, Hans. It almost feels that it's less about technology and more about actual partnership. It's the formation of an ecosystem in so many ways.
Exactly.
So CMS has mandated interoperability initiatives through a variety of rules to use HL7 FHIR APIs to improve the transportation of data and deter information blocking, amongst other things. While that makes sense at an industry level, what are the implications for you at an enterprise level? Does this signal improvement in the operating environment that is positive for your financials, as well as for provider experience, member health outcomes, etc.? And if so, just give us a couple of examples of an initiative in sort of the outcomes that you're able to achieve, just to make this all real for our audience.
Yeah, for sure. For sure. I would say, I hinted at this earlier, but any time that we can take manual error out of the equation and give consumers and providers access to information that's more real time, that's more consistent, and that's more reliable, it's a win for health outcomes and for both consumer and provider experience. Obviously, with portability and transparency, we have to take in the lens of patient privacy and security and ensure that we're putting the consumer in control of what can and should be shared with who and really what the purpose is. And so I think the question, similar to the first one, is less about what does this do to our financials and operating environment, and more to how do we rethink the way that information is shared so that the consumers are the ones that are making decisions about how their data is used, and then having that percolate to the various elements of the system that need it for that particular purpose. I can't specifically comment on the future roadmap for my organization, but I would say that we have partnered with a lot of different organizations to drive interoperability, both EMRs themselves. We do a lot of work with billing companies and revenue cycle management organizations, as well as directly with providers to enable better and more access to information. We partner quite a bit, and we're deeply involved in HL7, as well as the Da Vinci project. We've established the Synaptic Alliance through our Healthcare Technology Advisory Committee. And the Synaptic Alliance, as an example, is a blockchain initiative that is meant to improve provider data accuracy. And we've also partnered very closely with organizations such as WEDI to embrace some of the new standards related to claim submission and the unsolicited attachments across EDI, which reduces both the administrative burden associated with that, as well as the consumer experience to not have to worry about, is a medical record sent and received? Did the person actually need it? It really just improves the outcomes for both the providers and the members for which we support. And interoperability and some of the work that we're doing in that space has really empowered a lot of those changes.
Indeed, indeed. I mean, look, you are the largest health plan in the country, so anything and everything you do has a very large influence and impact, particularly with interoperability. So it is highly encouraging to see the amount of work that you're doing in that space, because it's only going to encourage not only your competitors but also the other health plans in the country to also lean in to make interoperability real, a little less conceptual and a little more real. So thank you. Let me ask you one last question, if you don't mind. Digital transformation. And to me, digital transformation is an umbrella term. People use that for a variety of things to describe. And I'd say one of the things that they tend to use it most to describe is modernization efforts, in the context of using the latest, greatest technology to improve business outcomes, as well as the adoption of emerging technologies to solve both legacy and contemporary challenges. So, as a health plan, I suspect there are many digital transformation initiatives in various stages of its journey. In you, as the chief product officer, probably have more of an insight into that compared to some of your other peers. What can you share in terms of the top three business reasons that are driving your digital transformation initiatives? One, and also talk to us a little bit about what those are and what are the kinds of outcomes you are targeting and are able to achieve.
Yeah, for sure. Appreciate it. It's a great question, and I would say that I can't speak to this specific upcoming roadmap, but I will say one of the really big changes for us at United Healthcare is that we are continuously and relentlessly focused on the consumer in a way that is really exciting, both as a person that is a member of United Healthcare, as well as an employee of the organization. Our goal is to really span the gap of digital and human beings and bring the world class digital capabilities that one should expect from United Healthcare and an organization of our size and scope. But those capabilities backed by the most empowered and compassionate service organization in the world. And so we're really, really bullish on this concept of how do we put the consumer at the center of everything that we do into 2023 and beyond. And a lot of the things that we're focused on are from that mindset of the consumer lens. So, for instance, how do we improve access to care? How do we provide better cost estimation so that the consumers are not surprised as to what they expected to pay and what the bill ended up being? How do we improve navigation and findability and really just take some of the abrasion out of common, simple tasks in a way that we can start to surprise and delight in those moments where consumers are coming to us and today it's difficult for them to navigate the complex healthcare ecosystem. And so we're really, really excited about the future, and it's all about the consumer and how do we take abrasion out of the consumer experience so that when people reach out to us, we have the best technology, we have the best people, and those people are empowered to solve problems and do so to surprise and delight the consumer with that interaction and the thing that they're trying to complete.
Fabulous. I think it's particularly critical in doing that, given the fact that the stress level of most members when they're trying to interact with health plans is already pretty high. And so eliminating or minimizing abrasion is probably going to be extremely critical in ensuring that they're able to achieve their outcomes in terms of improving their health. So, excellent. Hans, this is fabulous. Really appreciate your insights as well as your time. Thank you so very much.
Thank you very much. Have a great day.